Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, our topic is the experience of being a resident in a rural family medical residency program. It's really exciting to have the opportunity to talk to each of our residents that were part of the first cohort here at Indiana Regional Medical Center. And we're going to start with Dr. Tanvi Barathon. Dr. Barathon, can you tell us a little bit about yourself?
Hi, my name is Tanvi Barathon. I grew up in Indiana, Pennsylvania. So it was actually a dream come true to get this opportunity to work as a resident at IRMC. Actually grew up right behind the hospital. So it's pretty cool to be training here now. And I love football. Go Steelers.
I imagine you had a lot of options and choices in terms of which residency program to choose. Other than location, were there any other factors in choosing to come to the IRMC residency program?
So that's a good question. I actually trained in India. I lived in a huge city. I lived in California, which was also a big city for a while. And I realized pretty quickly that I wanted to be in a small town. I benefited from rural healthcare growing up, and I felt like I also wanted to be able to give back to a community like mine, and it just so happened to work out pretty wonderfully.
And also, growing up in this community, you've seen change and evolution of the medical center, seeing the program like this start. And, just curious, what perspective do you have and how having a residency program has changed or benefited the organization?
Well, I think it's fantastic. I think pretty much we recently, globally, everyone suffered a lot because of COVID. And now we're starting to see opportunities, educational opportunities such as residency programs, which attract people into smaller communities. And, like Dr. Valia mentioned, people that train in rural areas tend to stay in rural areas. And that's what we need in order to ensure that, everyone's getting appropriate health care. So I think it's really exciting, and I'm excited to see how it expands further from just family medicine.
Thanks for sharing that. And just, thinking of Dr. Valia's earlier comments about, not only attracting people to train in rural areas with the hope of staying, but developing people that are already from those rural areas to be able to train in their own community and stay in that community. Do you see yourself wanting to stay in a rural community after you complete your residency?
Absolutely, yes. I am a small town girl, even if I don't act like it sometimes. But it's like I said, it's so important. We need more rural physicians, more people interested in rural medicine. And I think this residency program is a great opportunity to open more doors for more people interested in pursuing something like this in the future.
Thank you very much, Dr. Barathon, for sharing those thoughts. Dr. Chadpar, welcome. Would you introduce yourself as well?
Sure. My name is Mohit Chadpar. I'm originally from New York, from Long Island. I went to undergrad in New York City, and then I decided to take a change and went to Mississippi for my master's in medical school. And I was in a small rural town of a population of about 7,000 people for most of my rotations. And now I'm here for residency, where I really love it.
What attracted you to come to the residency program here in Indiana?
I wanted to be part of something new. Trying to be the pioneer of the first class was something that really interested me. Just to be able to make changes, shape the community, teach the community more about what family medicine is, preventative medicine. I'm also a really big fan of Jimmy Stewart.
That's great. And you've had the chance to see a metropolitan setting and also another type of rural setting. So what differences do you see between Indiana and those other environments that you were in?
I would say in Indiana, there's a very supportive environment from the community as well as the medical side of the community. I feel everyone is really invested in improving the lives of the people that live here. It's not that they don't improve the lives of other places. I feel it's just there's a lot more people to be able to see those effects here. Sometimes some of the other communities I was in, transportation was a big issue, so a lot of times people couldn't even go to see a family medicine physician, you know, they wanted to. Here, I feel at least there's some public transportation that can help those people. So there is some advantages here, at least compared to some of the other places I've been in.
Were there any surprises after you got here and started living in the Indiana community?
I guess I was surprised at how friendly everyone was. I've been in some communities where people might not have been the friendliest, but everyone's been very welcoming to me, especially for someone not from the area or from Pennsylvania or even from a small town.
Given your chance to see different settings, where do you see yourself practicing after you complete your residency program?
I hope to stay in the area afterwards. I really love it here and will most likely be staying here after residency as well.
Well, thank you very much, and thanks for sharing a little bit about your experience with the residency program.
Thank you.
Dr. Sangha, would you please introduce yourself to our listeners as well?
Sure thing. My name is Dr. Narendra Sangha. I was born in India. I was raised in California, Modesto, California. I went to undergrad at UC Davis, did a post-baccalaureate at UPenn, and did some research at Thomas Jefferson University, and then finally went to medical school at St. George's University, and I was lucky enough to land a residency here in IRMC.
So as you were applying for various residencies and looking at options, what jumped out to you about the residency program here?
So what I really loved about the IRMC residency program here was during my second look, everybody was really hospitable. Everybody was very nice. I loved the community, basically how I was accepted, and just the feel and the vibe of the environment. And I think all that really attracted me. And being a program that we'd be the first year residents, I think it gave me an opportunity for leadership roles and also to kind of really pave my education or gear it towards what I really wanted it to turn out to be when I was practicing as an attending. So I think given that opportunity, I think it was a really strong point for me to come here.
Had you had exposure to working in a rural setting prior to the residency program here?
Yes, so most of my rotations were done in California and in Florida. So these are urban hospitals, really big hospitals. And in these places, we kind of had to really fight for procedures and really kind of took almost last seat to kind of, you really had to get through and kind of make your way if you wanted to be known. And if you wanted to learn something specific, you kind of had to go early and do all that. The best thing here is we have nobody really in front of us and are stepping on our toes. So if you want to learn a procedure, if we want to learn a new method, you learn directly from the source. So we're in contact with the attendings day in, day out, and it's a really good learning environment.
Can you share about any of the community outreach activities you've been able to participate in so far?
Absolutely. So one of my favorite outreach activities was at the Cookport Fair, where it was a local fair, and I participated in a wood sawing contest. It was my first time wood sawing with Dr. Valia's son, actually, and we landed 4th place. It was only because the competition ahead was pretty stiff, but I think we would have got a prize if one of those contenders wasn't there. But it was a really great experience, and just meeting, even at that fair, I ended up seeing one of my patients. So that goes to show how close-knit and how in the community you kind of get to see your patients and interact and all that as well.
Thanks for sharing that, and congratulations on the log sawing contest.
Thank you, appreciate it.
Dr. Rodriguez, welcome.
Hi, thank you. Thank you for having me.
Would you introduce yourself to our listeners as well?
Sure. Well, hello everyone. My name is Dr. Robin Rodriguez. I'd like to start off by saying I am a homeborn, homeschooled country girl. I was raised in a small town in Texas with a population of 318 people. So I've known from a pretty young age and going into medical school that I was going to want to work in a rural community. That is one of the big major reasons that I chose Indiana Regional. It was my #1 ranked residency residency program due to their vision as well as to their passion in serving the rural population. I was very blessed to be chosen by them as well, and I actually purchased my first home in Indiana, and I'm learning a lot about my community and having a wonderful time with that. So.
Well, thanks for sharing that, and a lot of exciting things there. And just first, coming from a smaller community originally, Indiana might seem a little bit larger by comparison. So what differences have you seen?
As I mentioned before, yes, I was from a very small town. Indiana has a lot of good restaurants. I think that's also to do with having the college here. But some of the great things about it, even though it is a little bit larger than where I was born, is the community, that community feel. Having that sense that I can go out and just walk around and people are friendly, and I'm getting to know my patients, and I can see them even outside of the clinic, and we have that familiar relationship. That was very important for me to be able to gain rapport and just to know my patients and know my community. So I really am enjoying that.
Well, it's great to hear that you're enjoying your time here. I'm sure people are curious what the experience of being a resident is like. Can you share maybe one of your recent training experiences or rotations and what it involved?
One of the things that I really like and also is amazing about my program, as a new program, we get the opportunity to enhance it for ourselves and the future residents. If there's anything that we're very interested in, we have a wonderful program director and wonderful faculty who are willing to hear us and help us. For me, for instance, I'm really interested in learning more about obstetrics. I want to come out of residency with an FMOB certification, and I've already talked to my obstetric attending. I already let him know about this. He's going to help me get as many vaginal deliveries as I need in order to complete this. They're very willing to help us in any passion that we would like to pursue, so it's been wonderful.
So that's interesting. As a resident, there's opportunities really to customize some of the experiences and some of the exposures to your specific areas of interest.
It's exactly right. So we have the opportunity to work the residency into where our passions really lie. For me, it's FMOB coming out. I really want to work in a rural community, and being able to work with obstetrics, work with mothers, help in delivery and deliver myself. So it's very important that I had that kind of training and I'm able to get it here.
What do you see as your next step after this residency program?
Well, I really do love the community of Indiana and the surrounding areas. So as I mentioned before, I purchased a home here, so it would be really nice if I'm able to stay. I have a master's in business. I'm hoping to make a outpatient clinic in a rural community. Hopefully this one. So we'll see where it goes.
Well, that's impressive to hear not only your medical studies, but also your business degree. Congratulations.
Thank you.
Dr. Al-Janabi, would you please introduce yourself to everyone?
Yeah, thank you for having us today. My name is Dr. Nawar Al-Janabi. I'm originally from Baghdad, born and raised over there. Then I came to United States as a refugee. Lived in Erie, Pennsylvania for a while. Then I'm lucky to be here at IRMC with the Family Medicine Residency Program.
What was something that stood out for you that attracted you to apply to this residency program?
Actually, the interest in establishing a refugee health program is one of the main things that make me make IRMC Family Medicine Residency Program on the top of my list. And I don't know if Dr. Valia mentioned, like, we as an applicant, we have to rank the programs that we interviewed at. So IRMC was like number one. So I was lucky to match to my number one program at my list. So yeah, also in my life, I have a lot of new starts. So also being in a newly starting program is something that I enjoy. I know all the stress, the struggle that may have in the beginning, but after 3, 5, then 10 years, when you see what you did, it tastes different. Yeah.
I imagine, coming and completing your medical studies, you have not just a choice of residency program, but a choice of what path you might want to pursue in terms of if you want to pursue a specialty or a particular area of medicine. And earlier, Dr. Valia was mentioning a little bit about family medicine and what makes a difference. I'm curious, what attracted you to family medicine in particular?
Yeah, actually, the long-term relationship that we will have with the patients. Also, me as a physician, I'm interested in preventative health, and I think we can do that through family medicine to all family members. And certain specialty, you can work only with adults, but you'll miss the children. So with family medicine, you can help all the family members to achieve to make them live a healthy life.
So that's interesting. So that holistic approach, hearing again of not just treating a condition, but really seeing a person. So I'm curious also, what's the experience like being part of a cohort? Often we look at things that we do and it's kind of an individual activity, but the residency seems to be very much, focused on the cohort and the collaboration and the relationship among the residents. Can you give some insights into that?
Oh yeah, that's very good. Now we are like the first class, so every one of us is on different rotation. So when we switch in the next month, each one will switch to another rotation. We meet, we kind of teach each other. And also, if someone in another rotation and needs some help, we can call each other and help. If someone has some free time, which is very rare in residency, but we can help each other if someone needs help.
And I understand the residency is a 3-year program. So by the time you're a third-year resident, how will that role and experience change? Will you have some extra responsibilities at that point?
Okay, yeah, so being a third-year resident is a huge responsibility. You will be responsible of teaching the second year, first year, and also the medical student that you have, in addition to your duties on the inpatient or outpatient clinic. But I think during the first and second year, you will be shaped to be prepared for this role.
I know that the program, residency program, is preparing for the next round of applicants. What advice would you give to someone who is considering applying to the residency program here?
Okay, the first thing, they have to be flexible. They have to be smart and willing to work in a team.
Thank you very much for sharing those insights. Just curious, any other things that you found in terms of coming to the Indiana community? Anything that you expected or that came up that was unexpected?
Yeah, I found there is a lot of bias about rural communities. I mean, when I came here, I have my parents with me, so we love the place. There is a lot of resources available. So yeah, there was a lot of bias about rural communities that when we came, we live in here, we really enjoy it.
Thank you for sharing that. Thank you so much for your time today.
Thank you for having us.
Family medical residency programs provide not only an educational opportunity, but an opportunity to learn about the culture and the community. We thank our family medical residents for joining us today and sharing some highlights of their experience. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.